guys, welcome back to Metien Vlogs. Today I'm coming to you with a video on therapy. I know this is not one of the scholarship videos that I'm always bringing you, but hear me out guys, because it's a very important topic that you and I need to know about and need to hear this. So first of all, do you know what therapy is? And do you know that every person in life actually needs therapy? If you've gone through any situation in life whereby you've gone through stress, depression, even depression is too deep. Let me just say you've gone through stressful situations, or maybe you feel like you're not yourself and you're wondering, how can I go about this situation? Then this video is for you. I'm going to bring an expert on board. She's a therapist and she's a psychologist, and she's going to tell us what is therapy, what is the position of therapy in the world, which kind of services do they offer, how can you know that you actually need to look for therapy services, okay? So I hope the video is going to be helpful to you. You're going to listen to her and then we'll learn more together, both me and you. So let's get started. Okay, so welcome back guys. Today I'm bringing to you Mukimba Rahedi, who is the founder of Pink Amazon Therapy, and she's going to tell us more about what she does, the place of therapy in society, because we go through so many things and most of us actually don't know that we can get help from a therapist and we can actually solve some of these issues that we go through. So without taking so much time, I'll ask her some questions. She'll tell us more about what she does, and we'll able to pick it up from there. So welcome Mukimba Rahedi. Please tell us a little bit more about you and what you do and about Pink Amazon Therapy.
Okay, thank you so much, Matrin, for this opportunity. I'm a huge fan of your channel, and I'm an avid watcher, so this is exciting. So I'm a counselor, I'm a mental health advocate, and I'm a mental health educator. I do speaking engagements and I do virtual therapy online, basically. So yeah, I'm a registered psychologist and a continuous mental health educator and a huge advocate for mental health. Yay!
Wow, that's so nice. I've gone through a lot of your content and what you do, and I think it's very important. And I'm just curious, what inspired you to go into this industry? Like, why psychology? Why therapy? What do you think it's the importance of the field you're in at the moment?
Psychology has a personal place in my heart. I have struggled myself with mental health for a long time. I was diagnosed with anxiety when I was in Form 2. So I must have been 16 or 15. And yeah, so over the years, I was looking for answers, you know, just like everybody else. And I was curious to find out how my mind worked. And I'm also a faith-based psychologist. I'm a Christian. I'm a born-again Christian. So I mix up the facts and my spirituality and also learning about psychology. I meshed that up. It helped me. So I try to help as many people through that.
Wow, that's kind of like you going through something and knowing there's need for that. I think it's also selfless, because for sure, I know so many people need therapy sessions, need therapy, but we actually don't know that we need. So maybe I should ask, how should I know, or when can I know that I actually need a therapist?
Every one of us needs therapy. Every single one of us has had something that has happened. Life has ups and downs. So every single one of us needs therapy. But then obviously, when you notice that you're not operating as you used to, the things that brought you joy no longer bring you joy. You're a lot more irritable. It's affecting your sleep. It's affecting the way you relate to people. You're reclusing, you're staying away from people. Then that might be a sign to just reach out for some help, because it could mean you have anxiety or you have depression, or it's just an overwhelming place of stress. Also, there's definitely people with alcohol problems or addiction issues, and definitely also people with actual psychological conditions, you know, like schizophrenia, when you're out of touch with reality, bipolar disorders, personality disorders. But basically, those ones a psychiatrist will diagnose, and then they'll incorporate therapy as well into the whole mix.
Wow. Well, so it's all about mental health. Like if I feel like, okay, something is happening, I'm not feeling okay, I'm not operating the way I usually operate, then it's time to actually reach out for some help, right?
Yeah.
So which age group do you deal with? Like, do you deal with only children, the youth, the old, or it doesn't matter?
Oh, it's really important to go with a therapist that works specifically with a certain, like, specializes. So for me, I have two specialties. I have a passion for young people. So I'm a young adults coach. So that's children between the age of 13 to 20, both male and female. And then basically young women, that's from ages 18 going on to women in their 40s. Those ones are also my niche because I am a woman ranging at around that age, and I understand what they're doing.
Okay, so maybe to go a little bit into the services you offer. If assume I need, I'm undergoing stress maybe in my career, and it's affecting my family life, it's affecting the way I'm relating with my friends, and I feel like, okay, I need to have therapy, and I want to book a session with you. Take us through how you do it, in short.
So for the first session, I advise that you just first, let's get to know each other. Yeah. Let's see if we blend, because that's also something that's very important in therapy is chemistry. And just because maybe somebody, and I need to give this disclaimer, if somebody has gone and they've tried therapy before and the therapist wasn't a good fit, don't generalize. Therapy is still good. Maybe it was the counselor that wasn't a good fit. So a good fit, we get to know each other, we learn about each other. I also see if I can help you, because it's good for me to be real about that, if I am able to help you. Then I carry out cognitive behavioral therapy, which averagely goes from 10 to 12 sessions. But most of my clients decide to just continuously take over their sessions, just a little bit more spaced out for a longer period of time. Even after the 12 sessions. And some, they want to be independent. They want to find out, can I do this without your assistance? So it's all accepted. But about 10 to 12 sessions is the average.
Okay, yeah. Wow. If someone just wants to speak to a therapist once, like they don't want maybe to have a session over a long period of time, is that also available?
Yeah. Sometimes people just want that space to vent, which is really important. Yeah. The behavioral therapy is when you're working towards certain goals. Like if you're working towards not being depressed anymore and enjoying every second of your life, whether or not things are the same, you might need the behavioral therapy. But sometimes maybe you just had a really bad day and you don't know how to process it. And you want to talk to somebody with confidentiality. So yeah, even one session is okay.
Okay. So this is maybe not out of topic, but a little bit on the side with regards to someone who wants to take a career line in psychology, in therapy. First of all, what are some of the things you can highlight to them? Or rather, if someone is divided, they're not sure if they want to take psychology or they want to go into therapy, what advice can you give them?
I had mentored somebody and we had that conversation, and I told them it's about authenticity. You've got to be also very clear about your own healing journey. And for me, there's nothing that I share with my clients that's not actionable. If I'm talking about reparenting myself, I have had to do that. I've had to go face my demons straight up and, do that self-work. So sometimes we've read the books and we've studied and we've passed the exams, but it's also important to actually live the life that you're preaching. So that you're not misleading people. Yeah.
Okay. And so what are some of the challenges? Because I know everything in life has a challenge. So what are some of those challenges you can highlight? There's this and this, someone should expect it if they want to come into this career line.
I don't know, I have heart for this and I'm such an uber positive person, but to be honest, we're in a good place. People are being open about mental health. People are being a lot more intentional about wanting to find out. Of recent, I'm getting a lot of speaking engagements because people do actually want people to be taught about this mental health education. It's really important. So there's opportunity. If you're authentic and you're hardworking, there's opportunity.
And maybe something that just crossed my mind, because sometimes I know when you're solving other people's problems, when you're a therapist, you're actually solving other people's problems. Does it ever get too much, or rather, how do you find a way to offload? Because you can imagine someone is talking to you about professional issues, another person relational issues. So you're trying to help them, but does it ever get to you? And if it does, how do you go about relieving all that's coming to you?
I'm a self-care princess. I take care of myself a lot. I really, really, really love taking care of myself. And I want to show up also for my kids. And that is way more important than my clients, I'll be honest. You learn to look after yourself. If you need to also talk to somebody, please go ahead. There's always therapists for therapists. We do that. We also have support systems. I also said I'm faith-based. So I have the church and I have community and people trying to help me out with this whole journey. So it's a good support system. It's good to find a support system and look after yourself. Always look after yourself. You can't be there for people if you're not well taken care of.
True, that's true. If you don't mind sharing that, do you have a price range, or does it depend on the need of someone? Does it depend on the number of sessions, or how do you go when it comes to pricing?
I'm very comfortable, I think, sharing the price because it's very affordable. My therapy sessions are very affordable because at the end of the day, they are virtual, they're convenient for me, they're convenient for my clients. For after hours, I charge about $14. 14 USD is about 1,400 Kenya shillings, 12 USD for normal sessions. And that's between 8 and 6, from 8 a.m. to 6 p.m.
To 6 p.m.
But anything beyond that is 14 USD, which is now after hours because people have different schedules. And for me, if it's, it's taking some time away from, like you say, time with your kids, it costs just a little bit extra. And then also it gets to $10 per session if you pay for more than 8 sessions at once. If you pay for all of them at once, it's about the range of $10 per session, which is $1,000.
I think it's really interesting that you have after 6 after work, because people who are maybe going to work during the day, they can always still find time to speak to you after 6. And what about the weekends? Do you take time off completely, or is it also possible?
I don't work on Sundays, but on Saturdays, it's just like a normal working day. So it's the same.
Okay. Wow, thank you so much. So I know these people are going to have many questions. They might want to reach out to you. They might want to maybe ask a question or even do therapy sessions. So how can they reach out to you?
Okay, there is our WhatsApp number. I think I'll share it with you and then you can share it with them. And then my website is just www.pinkamazontherapy.com. No extras, just small letters.com. And check out also the resources we have. There are a lot of free printables to help you with your mental health. There's a free gratitude journal. There's some affirmations. I think by the time this is going up, there'll also be something to do with how to set boundaries and just, like free stuff. So you can even start your journey even before you start your sessions. All these things are available for you.
And thank you so much for accepting to come to talk to us, because it's an honor to spend your time. I mean, to spare some time to come and be here. I'm sure it's helpful to people out here. Okay, thank you.